make a
Healthy
million.
But still,
order.
well, you know,
Previous business, can I
it's
get a
as
motion
low
to
as it's
approve
ever
previous
gonna be
meeting
sold.
minutes
Yes.
by
So I
Ally,
say,
second
Jane,
by
what do you
Brian, all in
think?
favor?
Oh, I give
Aye.
up.
Opposed?
Buy the motorcycle.
Opposed?
So I'm literally on my way to buy the motorcycle.
Number one, local law number S for 2018. Sponsored Charlie Callis is not here, so we will table this.
Would you
Number two, resolution number 494, public hearing on proposed local law number S. Again, we'll have to table this. Sponsor's not here. Number three, resolution number 524, reaffirming the terms of local law L for 2018. Paul.
Just here to give an update, Mr. Chairman. I'm not asking for any action tonight, and actually, Wanda and I met with the county executive's office to determine the congregate living contracts that were in place and the Meals on Wheels contracts that were in place. And they agreed that they would survey the folks who had that, and then they submitted some documentation which was circulated to the rest of the members of the county legislature. And I'll ask Mr. McLaughlin to say a word or two after I get done with the intro. But it appears that Senior Centers of Ravenna is impacted by the cost, and that it's impacted for the year 2019, and I guess they're going to go out to bid in 2020 to get new contracts, so it could potentially be it could potentially be a cost to them in 2020 as well. There were some other providers who sent the Department of Aging, we'll call it mixed messages, which was, yeah, we kind of have a styrofoam problem, but it may be going away. And I think then when they went back out to recanvass, it appeared that maybe some of those went away. So the way Wanda and I left it, with Wanda as the chair of Elder Care, was that we would await some further information from the county executive's office on whether there was a mechanism to adjust some pricing for the people that were adversely impacted, because some of the data that they did show was that the alternatives that they had were in many instances almost double the cost of what they were paying. So with that, is it okay if we ask Mr. McLaughlin to say a few words?
Sure.
Thank you, Mr. Chairman. So, yeah, basically we received correspondence back from all of our congregate and home delivered meal providers through Department for Aging. The only one who will need to transition away from styrofoam is Senior Projects of Ravenna. We were able to determine in terms of the increased cost, Aging was able to confirm through NYSOFA, the state aging agency, that there is a mechanism within the funding structure for a provider to petition for a cost of COLA, if you will, cost of living adjustment, if they're able to demonstrate a cost increase. And there are obviously safety mechanisms built into this so that they can't make wild claims that their costs have skyrocketed for reasons that are unjustifiable. And they were able to confirm that a cost increase that was a result of this sort of thing would be a qualifying reason to receive a COLA. So we believe and hope that if Senior Projects of Ravenna is unable to find an alternative to styrofoam that is of equal value to what the styrofoam, or excuse me, equal cost to what styrofoam was costing them, that we should be able to accommodate that increase through this mechanism.
Okay. Lynn?
During my experience at the co-op, when we went away from styrofoam, it's difficult, but it's not. We didn't find it completely impossible. I was wondering if you knew if they're looking at replacing what they're using as styrofoam or looking at doing it a different way.
So when we basically went out to, so we've asked our providers this question a couple times, and of course it dates back years at this point because of the previous regulation. So I can't speak to whether or not some of the providers kind of saw the writing on the wall and moved away from it on their own, if they found other products that they preferred that were cost effective and went that way, or they're doing this immediately because they now see that the new regulation is coming down on them. The information we got back from Senior Projects of Ravenna was a one-to-one comparison of this is what we currently use, styrofoam, the most equivalent product, non-styrofoam is this, and this is the cost.
Okay. Thanks.
Well, the other issue here is, and I asked Mike when I talked to him earlier this week, a lot of this was premised when I put the legislation together was we didn't have a clear signal as to what the waiver process would be. And I guess they're getting much closer to publicly making the waiver process available, which anybody can apply for the waiver process as well, and if they can show just cause, they would be considered. So if there is an administrative way to resolve this, which it sounds like there is, and there's a waiver provision, it would probably make this legislation unnecessary.
So, would you like to table it for now?
Yeah, absolutely. I mean, I'm trying to explain to people why I
Sure.
don't think it's necessary to go forward, and I really got to thank Wanda for digging in on this as well, because there's nobody who wanted to do anything here other than to save a not-for-profit some money.
Sure, okay. Move on to request from the sponsor. Thank you, Paul. Under current business, number 4, authorizing an agreement with Albany Medical Center regarding morgue and laboratory services. Tim, how are you?
Good, Mr. Chairman, how are you?
Good, thank you.
Be happy to answer any questions. As everybody's well aware, Albany Med increased their rates. Originally, they were going to shut down their morgue and toxicology lab, which they did shut down the lab, but their autopsy room, they wanted to shut it down, and they, after pressure from several counties, many counties, like 12 counties that it affected, they decided to keep it open, increase their rates to $2,000 per case. We were paying about $860.
2,000?
2,000.
Hey, Gary?
So 12 counties
12
that
counties.
send people there.
Right.
They send people there.
Right.
It's not the people who come here and die
No,
from those 12
No,
counties.
they send people here, just say up north.
So
They'll send
whatever
an
happened to that
autopsy up.
meeting we had with Albany Med, when we were paying, now we're paying $2,000. That's a
$2,000
lot
a
of
case.
money for an
Yeah,
autopsy.
yeah, it's gonna be an
For
increase.
a lot of people
Increase
that
is
come
probably
to
almost
Albany-
300,000 for us.
Well, you know what? We gotta look at that. Because we're looking at bringing those people into Albany Med, flying them into Albany Med from all over the friggin' Northeast, dying there, and the Albany County taxpayers getting stuck with the bill.
Great.
That's
Right.
outrageous.
You're right.
Outrageous.
You
And
were
something's
right.
gotta be done about that.
Yeah.
You know, I mean, we can't be
Gary,
holding
you-
them.
Gary,
$800 is one thing. I've been talking about this for 10 years.
No, longer than that.
You
Longer
know,
than that. You bring it up all the time, but then all of a sudden it's like
$2,000 is a
drop,
lot
you
of
know?
money.
So, no, I understand. I agree.
Do they justify,
Here's,
I'm not talking,
No,
this
no.
isn't on you.
no, I know.
You're stuck in the middle because
That's
they're
right.
the only game in town.
Yeah, they are.
Well, what's Ellis charging us?
700.
So why do we even
On-
bother
on-
going?
If you give me a minute, on the good side, 2 weeks out of the month, we're using Ellis.
I know.
So we did 248 autopsies last year. Hopefully, we can do about half them out of Ellis. The only increase with Ellis would be the transportation from the city or from the hospital to Ellis. So we will be saving there. Out of all the 12 counties, we take the biggest hit.
What about the Albany Med, that meeting? Anything you ever come out, or they just told us to go?
Albany Med, here's the way, I personally, the way they look at it, you either like it, if you don't like it, go somewhere else. But there is nowhere else.
Is that state law that we have to,
Yes.
so we have to do a resolution with, asking the state to, we gotta change that. We gotta change that law. This is hurting Albany County.
Oh, sure.
$300,000
Well,
is,
other counties also. I mean, you know, something, if
don't think
somebody's
other
transferred
counties.
from
I think
Water
that
Bleed
Albany
over to Samaritan Hospital and they die over there, they're Rensselaer County's
Yeah.
responsibility.
I don't care about
But
Rensselaer
we do,
County.
we do take a big hit.
Because we
Let
have
me
the
just
center
say
of
this,
everything.
let me just say
We're a
this,
Region
that
1 trauma.
300,000, you're almost looking at a 0.5%, all you conservatives, you're looking at almost a 0.5% property tax increase, just to cover the cost of that.
I agree.
Now, that, maybe that'll be my project for 2019. I understand there's press conference tomorrow, touting what they want to do in 2019. I think that might be my project for 2019, and ask that many others join in, that we look at Albany County, relationship with Albany Med. And I think Albany Med does a wonderful job.
Oh, they do.
They do, I
Great
think,
job.
but I think they're,
There's other
You
questions.
know-
they're not being too friendly to Albany County.
Well, guess what? Like I said, they're gonna shut it right down. And personally, I really think down the road, they're gonna close it down. They don't wanna do it no more.
Well, that's why I went to $2,000, because you guys still want to come, you're gonna pay me.
Well, we have no
I mean,
choice. You know, we
they
have
know
people
that. They
die
know that.
in Albany County daily, and on top of the 250 autopsies, we probably bring in 75 cases a year where there's no family, we can't find family. They're underneath the care of a doctor, but the families don't have a funeral home, financially strapped. I mean, I got 2 cases from the weekend that they're still in Albany Med. They weren't autopsy, but they're there, you know? And
That's the
until we find
unfortunate
next
part
of kin.
of your job, you know, and that's part of your job that a lot of people don't know what you do when it comes to finding those people that don't have families.
I've been telling you for 30 years, I'd like to take you out on a
And
couple
that's
of
why I
these calls.
support keeping coroners instead of medical examiners.
Yeah, It's not
For
easy.
what you do.
It's not easy.
You know, it's,
You know, it's not
there's a
easy.
big difference.
I'll move on to Ally now.
So, Assemblymember Stack did legislation on this, and we never had a Senate sponsor. But now that the Senate has, switched, there is now a Senate sponsor. Senator Breslin has picked it up. Unfortunately, we do have the challenge where we are Albany Med is a Region 1 trauma center. And so people do come in from all over. And that is a reality. I mean, there are only certain, a level 1 regional trauma center, I should say. And so a lot of people do end up coming here, and that's why we do
Absolutely. I mean,
take the biggest
that's
hit.
the problem.
The wonderful thing is Senator Breslin has picked this up, and hopefully they will see action on it. A lot of other counties obviously would want to push back simply because who wants to start getting billed back? But as we know, I believe that not only does the city of Albany take a big hit, but then there's the added to the county of in the nonprofit status, but also the added where you have the challenge of the
Could you
autopsies
send me
and
that
everything.
legislation?
It would
Because
be
there's
my
also, it's
pleasure.
gotta be tweaked, because we should be able to bill those insurance companies, which we don't do.
I don't think that's possible, but, that's above me, so.
No, but,
You know,
we don't do it.
looking
I mean,
at-
there should be ways to, to generate.
Mr. Drake?
You spoke of transportation costs, you know what those average over to Ellis?
Over at Ellis, so Ellis did 75 autopsies for us last year.
So just
Somebody
on-
dies in the emergency room at Albany Med, it's a trauma case, and it's the week we're using Ellis, so we hire a funeral director to transport from Albany Med to Ellis, $225 they're paid.
Okay, so the net cost is between 900 and 1,000
Right.
to Ellis. Okay,
right.
so it's a screaming deal
now.
compared to
For now.
Albany Med for now.
For
So
now. I mean, Ellis could say.
is there an ability for us to expand our contract with Ellis? In the interim, I know Gary's making it the year of reform, but in between now and then, could we do more work with Ellis?
We're gonna do 2 weeks. We've been doing 1 week, this past year, 2018. So now we're gonna do 2 weeks out
So
there.
we've had about
Our other issue
125.
is the pathologists.
Yeah.
2 work out of Albany Med, 2 work out of Ellis now. It's like when you need specialty surgery and your surgeon tells you, I work out of Albany Med, you're gonna go there. Same way with these pathologists. So we're hoping this coming year, we could do 125 autopsies out there instead of down here. So we will save in that direction.
So we're talking about $125,000 difference though, roughly. between the present day rates and the new rates.
Right.
Okay, when do the new rates take effect? I may have missed it, I'm sorry.
December 1st for
The end of this year.
18. No.
Oh, for 18, okay, so we're going back.
They said December 1st, 2018, we'll continue to do them. The new rate is $2,000.
Okay, so budget-wise, we have that in there, the 125 or not?
No.
Okay, so we got
We budgeted
125,000.
$205,000 for the hospitals, but this was already taken care of before Albany Med decided to put everybody on the spot, so.
So is there any way then of taking some of that $125,000 projected shortfall and eating it up by doing more outsourcing to Ellis, or is there another alternative other than Ellis?
Like I said, there's no other.
And what limits us from doing
St. Peter's
additional?
doesn't do them, Memorial doesn't do them, the VA doesn't do them, Samaritan Hospital doesn't do them.
What limits us from doing more with Ellis?
The extra week with the doctors on, Dr. Hubbard's gonna do his out there now also.
Okay.
from
So it's the
75
physicians aren't available, the pathologists aren't available? That's the issue?
We got 2 that are gonna work out of Ellis and 2 doing at Albany Med.
Okay.
And like, Ellis is a nice facility, but they can't handle our volume.
Yeah, I was gonna say.
Volume
it was
issue.
a volume issue.
You know, Albany Med, you walk in there and they got refrigeration, there's 80 people in there. And there's many times you walk in there and there's 80 people in there.
It's an ongoing issue with Albany Med being the only game in town for as long as I've been here.
Yeah,
Um,
long term, maybe Albany, Schenectady, Rensselaer, Saratoga could look into building their own facility, doing them all, their own, you know? Because I really believe Albany Med's gonna close shop sooner or later.
A regional facility.
But all I know is my job, people die daily. Albany County, we need a place to go, whether it's Albany Med or Ellis or both. We need to get that job done.
Have no question, Paul?
Just not a member of the committee, but is there any way that somebody can tell us, or you have an association, or does anybody, it strikes me that there should be some sort of insurance coverage for, mandated even post-mortuary health care.
You mean,
I mean, I don't know if it exists.
Health insurance?
Yeah, if it exists any place else
Yeah, I
in the
was here a couple
country.
years ago, I believe Gary brought that up, and I think Dr. Hubbard was here with me, and he says,
No, he said no.
Doesn't exist.
no, doesn't exist.
The other question I have is out of
A lot
the,
of these autopsies are mandated,
Yeah,
state.
yeah.
So, I mean, we have a serious opiate issue going on.
The other question I had
We do a lot more autopsies.
is obviously I understand the increase. Out of the 258 autopsies, how many of them were actually Albany County residents?
Oh, I can't tell you that right now.
We get that information.
Because it would seem really that the real cost that you're talking about from the other counties, people who come here,
It was substantial.
yeah,
You know, you get
50%.
people that die in hotel rooms,
Yeah.
they're from outside the area.
Yeah.
They could die here even, and they're not,
I think the issue that
got
people
them
are,
over the airport here.
I think the issue people are bringing up is they're shipping them in for I said service, that's ridiculous, for treatment at the facility, and then they are expiring here, and then we're responsible. Versus if you're here in a hotel room, you're our responsibility.
Yeah, that's not what-
You're
that's
visiting.
not the problem.
Yeah, it's sending them in
Nobody
for
has a
care,
problem with
and then
that.
we're footing the bill.
And as they're here at Albany Med in the intensive care unit, you think Albany Med's billing somebody? They fly them down here, you think Albany Med does that for free? So there's somebody they're billing. And there's gotta be some way for us to recoup some of that money.
Mr. Kavanaugh, do you know of any, you mentioned associate, I don't know, people talk, I'm sure, in your field. Do you know of any counties that do bill the hospitals for these things?
None.
Okay.
No, it's law, you can't go after it.
Okay.
Any other questions for Mr. Kavanaugh?
Thank you.
Can I get a motion? Oh, go ahead.
You mentioned the open, I'm just wondering, do you have any numbers on the increase in that you've seen through your office, the desk?
There's definitely an increase. I don't have the exact numbers offhand, but sometimes it feels like we have at least one a week here in Albany County. I had one Thursday night and I had one Saturday. But it's a serious issue.
Yeah, no.
Benefits having a trauma center in Albany this is the downside, I guess.
Motion moved.
Motion by Gary, second by
I'll
Mr.
second.
Drake, all in favor? Any
Aye.
opposed? Unanimous. Okay. Number 5, authorizing an agreement with the NMS Labs regarding forensic toxicology laboratory services.
Motion to move it.
Excuse me, just for the committee, this can't be moved yet.
No?
I've spoken to the coroner about this. We have some procurement issues that we gotta go through prior to moving this out, so it's gonna have to be tabled.
You know, Gary, like I said, as long as I've been coroner, 32 years, we've been using Albany Med's
Oh, I know.
lab. They shut it right down, so we have nowhere to go for tox. So we've been using this national lab, MNS, and all the surrounding counties have already jumped on board using that lab also. So I guess it's got to go out to bid, and I'll probably see you at the end of next month.
Okay.
Table it.
So, can I get a motion to table? By Gary, second by Mr. Drake, all in favor, any opposed? Unanimous.
Thank you.
Thank you, sir.
Yep, take care.
Thank you.
Thank you, Tim. Number 6, authorizing an agreement with Better Health of Northeast New York Incorporated regarding behavioral health stabilization services. Dr. Giordano,
Good evening, Mr. Chairman.
here.
I'm here tonight to request permission to renew a contract that was approved by this body last year, resolution number 111 in March of 2018. It's for $243,657 with the Better Health of Northeastern New York, and it's for the purposes of an expansion to our mobile crisis team. And we are about 3/4 of the way through the first year of that contract, and it was performance-based, and we have, I'm proud to say we have crushed it. We're well ahead of the marks that we've been asked to be, and we hope that'll continue into the second year, and that third year funding will come as a result. But this is a renewal of something we talked about last year.
Any questions for Dr. Giordano? Okay, motion moved. Gary, second by Lynn, all in favor?
Aye.
Opposed? Unanimous.
Thank you all.
Number 7, amending resolution number 60 for 2018 regarding the Million Hearts program.
They knows they got us.
Well, how are you?
Good,
Oh,
how are you?
Ms. Witherspoon, too, how are you?
So our first one is just to request to, for a no-cost extension to a previous resolution from last year of our contract that we had with NACCHO for the Million Hearts campaign. And it is a no-cost extension to allow us to just get reimbursed for grant activities that were performed after the deadline of June 30th, 2018.
Any questions for Dr. Whalen? Can I get a motion moved? By Whalen, second by Ally, all in favor?
Aye.
Opposed? Unanimous.
The second one is a request to get additional funds for our rabies grant. We budgeted originally $47,234 for 2019, so we're requesting a budget amendment for the additional $1,838 and permission to contract with New York State Department of Health for this.
Again, any questions for Dr. Whalen? Get a motion moved. Mr. Drake, second by Ally, all in favor? Any opposed?
Aye.
Thank you, thank you.
Thank you.
Motion to adjourn.